ultrasound session, we want to do injection giving, which is one of the most important procedures. So it's a sterile procedure. Some people call it as a semi-sterile, but in nursing there is nothing like semi-sterile because of you're not using the gloves, you're not using the forceps, so they just call it to say no. After gloving, then you, since you are not gloving, then you can call it as a semi-sterile, but it's not a semi-sterile procedure. It is the sterile procedure, a full sterile procedure. So now let's go to the indications of this, because we are giving intramuscular, isn't it? So if we are giving intramuscular, there are certain kind of knowledge we need to have so that we do not give the drug in the wrong position. Okay? What are the indications?
Unconscious patients.
Unconscious patients, right? There are those patients who cannot swallow the drug. So what do we do? If the drug you're supposed to give can also be prepared as a drug which can be given intramuscularly, then you can still give. Then the other one?
When quick action is needed.
Quick extra what?
Quick action.
Quick action is needed. You can give because you are giving direct into the what? The muscle. Okay? You are giving it direct into the muscle. So that way the drug will just be absorbed direct into the what? The cells, and the cells will absorb the drug. Okay? The next one?
To satisfy a psychological desire.
There are some patients, probably they just want to, they just feel good when they get an injection, eh? So what do? Sometimes we can even give them a placebo. It is not medication, but you just give them so that you can satisfy their psychological aspect where they just want the injection. But we are not giving them the drug unless the drug is prepared to say this drug is also found in liquid form, then you can give the same drug because they are just used to that. But we also need to start now training those or teaching those patients so that in as much as they can say we need to give the patient or we need to get an injection, you also need to start now teaching them the importance of getting oral drugs, isn't it? What are the principles?
Verify the order on patient's medication sheet 3 times before giving.
This is the patient medication sheet or the drug chart, right? So you need to verify 3 times. Don't ask their name. Patients are fond of drugs or injections. Some, they just want an injection. So you don't tell them to say, you are Mr. James. Then you start the procedure. Please confirm. Let them tell you the name. That's when you can confirm. So you verify 3 times when you are doing the procedure. What else?
Make sure you have a written order for every medication given.
The written, do not give the drug if there is no written order, there is no prescription. Do not give that drug. Even if you are working, you are a student nurse, you have gone maybe to the hospital, then you are doing practicums there. Then they tell you, this nurse just tells you, can you just give the drug on that particular patient? She even gives you the injection or the syringe. The next thing that you do is to get now the syringe and you start now giving. Do not do that. You are not the one who prepared that drug. You can only give something that you have prepared, right? Unless maybe when it comes to shima, right? You can eat even when you are not the one who prepared the shima. But when it comes to drugs, we don't give drugs if you are not the one who prepared. Number 1. Number 2, you are not the one who calculated. You are not even the one who knows the patient. You haven't even seen the patient. You just go direct and give. If anything happens to that patient, you'll be responsible. If she reacts, if the patient reacts, you'll be responsible. Why? Because you did not understand what you're doing. What else is there?
Verbal orders should be signed by the doctor within 24 hours.
So for example, this is the doctor who just says, okay, the condition of this particular patient is very critical. What do we need? The doctor maybe is very busy with maybe the doctor or the clinician is working on the patient, right? And that drug, they just say, oh, I think looking at the condition, we need this drug. And the doctor tells you to say, let's give. You can go ahead, right? You're with the doctor there. You can go ahead, but you need to make sure that that drug is supposed to be signed. Are we together? Anything that happens, you need to do what? You'll be responsible. So those verbal orders, according to what is there, they are supposed to be signed within 24 hours. Okay. What else is there?
Check the expiry date.
You check for the expiry date. Okay. Then the prerequisite knowledge. We do not give the drug which is expired. Okay. We can only give the drug which is not expired. If the drug is expired, it has lost its potency. It cannot even work. The patient might even react badly to that drug. So now, what is the prerequisite knowledge? What kind of knowledge do we need to have as we are giving these drugs? Hello, because some of the knowledge that the prerequisite knowledge we need to get or to have is also applicable when we are giving the oral medication, the oral drug. The first one is what?
Knowledge of pharmacology.
Exactly, knowledge of pharmacology. We understand pharmacology, right? Mm-hmm. What are the principles? We know the principles. Number one. No, those are the rules. Those are the rules. Pharmaco what? Kinetics, right? Kinetic is about movement, isn't it? How the drug will move, right? If the drug is supposed to move from the muscle, how is it going to move? What receptors are going to help that now? Or what is the transport system the drug is going to use? Isn't it? What else? The dynamics, the changes that will occur, the alteration that will occur within the cells. What else? Pharmacology? Therapeutic drugs are used for what? It's for therapy, right? What else? Pharmacoeconomics. You cannot just continue giving the drug. Drugs are expensive. Drugs are expensive, so you cannot just continue giving. That's why even on the ward you will find that after 3 days the patient is what? Discharged. It's not because of the reactions, the drug, but also we got what? It was just a running for the drug. Just running those drugs is very expensive. So we need to understand. So that when we give the drug, we do not give the drug that will go into waste. What else? So there are quite a number of them, but we also need to understand how are these drugs absorbed, right? How are they transported from this cell to another cell? Do they need the transporter, the transport system? What kind of proteins will be needed for these drugs to be transported from this cell to another cell? And what will be the interaction? Why is it that when a patient gets this drug, they're going to react? What really happens? Okay, so we're understanding the physiology of that drug. Why is the patient becoming like the patient feel nauseated when they take maybe oral drugs? Okay, why is it that we are just giving the drugs into the intramuscular or into the muscles? Why can't we give the drug into maybe the mouth? What types of drugs are destroyed by the intestinal juices? Okay, and the drugs that cannot be destroyed, and what type of drugs works well on this particular system, and the drugs that cannot work. When we understand those things, it will be very easy for us to do what? To give even the right drug. Okay, and also need to understand those the rights, isn't it? Where we are saying the right what? Right drug. The next one? The right patient. Right what? The right dose. Yes. Right time. Then the right route, isn't it? The last one? They are just fine? So if we understand that, so how are we going to get now this? We are going to do now the procedure, isn't it? The next thing, because we need to understand that this particular we are giving them intramuscular, isn't it? So we can give on the gluteal muscle, the muscles that are found on the buttocks, and we can also give intramuscular where? The deltoid, isn't it? But again, we need to understand the anatomy of that, because that is the next statement. The anatomy. Why should we demarcate? Are we together? If we are demarcating the gluteal muscle, why should we demarcate, and what landmarks are we using? Okay? Then, the next thing that we need to understand, if you are giving on the deltoid muscle, or the deltoid muscle, rather, which muscle, since we are talking about the deltoid, you should go and check your muscles, eh? Here it has a triangle, right? It has a triangle. Now, what are the landmarks? Okay, the acromion process, which is on top there, you put 2 fingers there, then down there, that's where now you are going to what? To inject. Are we together? From the acromion process to the deltoid what? Muscle. But if you are giving on the gluteal muscle, we are going to see those landmarks. I think those are the things that we need to have before we can dive into the procedure. Can we do the procedure? Okay, we'll do step by step, right? Okay. If it will be for 30 minutes, it will be for 30 minutes. 1 hour will be an hour, so that you can go in the rest of your time. Stop dozing. Those who are dozing, please. Okay, so we said the patient, Mr. James, the assistant, you can wash your hands in advance. The assistant, you can wash your hands in advance. Do you have a flannel? Okay, then you're the injured, right? Okay. It's afternoon. Good afternoon, madam. I'm student Munya from Rusang University. I have been assigned to give benzathine penicillin 3 grams on Mr. James, which is supposed to be given IM at 16 hours, and it is due. Is it okay? Can go ahead. So the in charge will give me the keys. Okay, she has given me the permission and she has to give me the keys so that I can go at it and get. Okay? So the next thing, I need to wash my hands. Okay? Initially, you're supposed to stand on the right side of the patient, right? Okay. Good morning, sir.
Good afternoon.
Good afternoon, right? Sorry. So good afternoon, sir.
Good afternoon.
I'm student Muenya from Rusang University. May I know your name, please?
Mr. James.
Okay, you're Mr. James. So this is the first time I'm confirming for the what? For the name, okay? Okay. He's Mr. James. And I also confirmed the right what? Patient, isn't it? So, Mr. James, I am supposed to give you a drug which is benzathine penicillin, 3 grams on the gluteal muscle, depending on the patient if they understand those terminologies, okay? But for the sake of learning, you use the same terminologies. On the gluteal muscle, this drug is going to eradicate or reduce the multiplication of the microorganisms that are making your condition to be worse. So we are going to give you on the gluteal muscle, and don't worry, we'll put the screens for privacy so that we maintain the privacy, okay? Is it okay that I can go ahead with the injection? All right, thank you so much. So I'll be back. Let me just go and prepare so that I can come back and assess where you're sleeping. Okay. So after getting the consent, I need to wash my hands and go with what? The gloves. Now, when I go with the gloves, I'm not going to be donning the gloves. Initially, I'm supposed to put the gloves in what? The receiver. And the receiver is very small. Okay. Good afternoon, sir. You said your name is it?
Mr. James.
Okay, Mr. James. So I've confirmed for the second time, okay? So now I want to assess and see the general condition for this patient. So now, when you're assessing, we start with inspecting, okay? Inspection, the smell that is coming from the patient, right? I'm talking to the patient, but there is halitosis. So what do I do? We change the procedure with immediate effect. We change you don't have to inject. Already the hygienic measures are what? Compromised. So what do? We change the procedure. Are we together? Before we change the procedure, I inspect the eyes. The patient did not even wash the face, right? The patient did not wash the face. The patient hasn't even cleaned the mouth, so there is no oral care. Okay, so as I inspect, I see the general condition of the patient. Since I need to touch the patient, what do? I need to don in gloves. These are the examination gloves. So, Mr. James, I'll expose you a bit so that I can just see where you're sleeping. Okay, I see that where you're sleeping it is okay, but if you find that the patient needs to go, maybe the patient has done some businesses there, you need to change the linen. Okay, then we see. So the next thing if the patient is in the hospital gown, I'm going to expose the patient, okay? So we are going to turn the patient, isn't it? We'll turn the patient because this is patient preparation, okay? So we are going to turn this particular patient with the help of the what? The assistant. So the assistant is supposed to be in gloves. So when we turn the patient, what are we expecting from the patient? Number one, when we turn the patient, we need to turn the patient and tell the patient to say, I am going to give you the injection where? On this part. So that we prepare the patient psychologically, okay? Before that, or after that, when you turn the patient, you are not going to leave the patient in that position for long. Okay, so you are going to leave the patient in the comfortable position. But if you find that the patient needs to be changed, you need to clean the patient. If it is to bath the patient, you bath the patient. Are we together? So now we have assessed, okay, the general condition. Now, since this one is going into the muscles, if I am checking on the gluteal muscle, if I find that the other gluteal muscle is affected, maybe with maybe some wounds, I am going to change. Are we together? I am going to change so that we change the position. Okay, we are inspecting the skin, the health condition of the skin, the health status of the patient, and also check the muscular system. Are these muscles going to allow us to give that particular drug? Because you find that maybe the muscles, they are affected with maybe veins, or they are affected with the wounds, or the patient, probably maybe the patient has what? Maybe the sores, a lot of sores, isn't it? Okay. So now, if the patient says, we see that the patient is okay, where the patient is sleeping, the next thing is to prepare now the patient, okay? So how do we prepare the patient? We'll get the Macintosh. So with the help of the assistant, we'll put now the Macintosh. So wait, just the draw sheet. So I'll receive the patient from this end so that the assistant can now straighten it a bit. So we have prepared the patient. So before we go that, because we are not going to use this patient for injection, we are going to use for this one for demonstration sake. So now, just for the landmarks, can we turn the patient so that we can see the landmarks? The patient has to be, let's position the patient in front. Okay, now, we were supposed to prepare the patient and see the landmarks, right? So now, when you are giving, you demarcate the buttocks, okay, or the gluteal muscle. So we are starting from this bone, okay? This bone, then we are starting from this bone. So from the iliac crest, we will make a line up to the fold of the buttocks, okay? Then from the sacral region to the what is the greater trochanter. Then where are we going to inject? On the upper outer quadrant, isn't it? That's what we are going to give, okay? So we tell the patient to say we are going to give, but we are not going to leave the patient in this position. Are we together? Unless if the patient feels comfortable in this position, you can leave the patient in that position. But if the patient is not comfortable, you can just leave the patient in a comfortable position, okay? So we can now leave the patient in the comfortable position. Our patient also. Okay. Are we together? So we cover the patient like that and assure the patient that privacy will still be maintained. I am going to do what? To prepare now the what? The trolley. In the treatment room, Since the patient is on the ward, we'll prepare now from the treatment room. So now, okay. So now, at this point, you wash your hands. Okay. What do we need now is to prepare the trolley, isn't it? Can we concentrate on the trolley, please? So now, when you look at the trolley, it is already set. What we need, we have the receiver for disinfections, isn't it? So that for decontamination, so that those receivers, the small receivers, actually you are supposed to have, if you are doing this procedure, you need to have those small buckets where you can, the decontamination corner, you need to have a separate decontamination corner. If you are doing it from the wards, you can have the decontamination corner. Are we together? If you are doing it from the treatment room, there you already have the decontamination corner. So you don't need the receiver for what? For decontamination, we are going to put 0.5 chlorine or jig. Okay. Then we also need the drug. We need the spirit. We need the syringes. We need the examination gloves. We need the flannel, the sterile one. Then we need the gallipots and the cotton swabs. Okay. Now, here we need to prepare, and you need to pay much attention because the things that are there may confuse you a bit. So now, there is this Tito forceps. For the sake of let's put it here. Okay. So now I need to tell the assistant. Okay. So I can go that side, or we can just remove it. So here we have space there. Okay, so number one, let's see now what we have. You compare, you check first the drug chart, right? We are saying we are giving how many meals? We haven't calculated, isn't it? But what are we giving? 3 grams, right? What are we reconstituting it with? 8 meals. Are we together? Okay, so what we need, I need the assistant to get the what? The chlorine, but sorry, not chlorine, but spirit. But spirit I can get it on my own, isn't it? So the only thing that I need is the assistant to open the what? The drum, so that I can have enough what? Enough swab. So you can open the drum. So this side, okay. Because in most cases when you have prepared this pack, we don't sterilize, including the what? The pack doesn't come with the cotton wool, so you need to prepare for that. Okay. The next thing that you are going to get is to open the what? So before we open the syringes, so that we can know. Remember we are saying pharmacology, economics, right? So that we do not get a lot. What do? We check what is there. I get the drug. The drug is 5 mega units, right? Okay, where we need to dilute with 80 mils. I will check first for the what? The expiring date, isn't it? So now since I've checked, it's 5 mega units, and I need to get what? How many mils? How many? 3 grams, isn't it? So since I'm getting 3 grams, what do? I need to calculate, okay? So let's calculate first. We can calculate. What's the formula? The drug that we are giving. The drug to be given is what? Doctor's order. Divide by what? Available times the volume, right? What is the doctor's order? 3 divided by 5 times 8 meals, depending on the hospital policy or what the doctor said. So what is 3 divided by this times 8? What are we getting? What is 3 times this? That is what? Divided by 5. What are we getting from there? 4 point what? Are we sure? Can we get the right? That's what you calculated? On the phone? It's 4.80? So now when it comes, we are given 4.80 mils. So when we reconstitute with 8 mils, we are just going to get what? 4.8. Now when it comes to drugs, we do not round off. Hello? We do not round off. So 4.8 will remain 4.8. Now, since we have calculated, okay? Since we have calculated, what do we need? Is the what? The syringes, okay? We are given 4.8. Do we need 2 syringes for withdrawing? We just need 1, isn't it? So we are going to get 2 syringes. 1 for withdrawing the syringes from the drug. So can I get the 10 cc's from there? You read what is there, the expiring date. Is that the 10 cc's or 5? Okay, it's okay, that one will be used for withdrawing the drug to give to the patient. Expiring date? Initially, you, the one of the procedure, the one who is supposed to read. Okay? So now it's expiring when? You read, give me. Can you just open it? From that side? On top. Okay. Can I get another one? The 10 cc's? Check the 10 cc's. The one with 10 mils. The bigger one. I think that's the same one. When is it expiring? 2026. What is for you? But this is 2026. Let's get 2 syringes, two needles. You tell us what is there. Potence for you, okay? You can be opened from there on top. Yes. Then you get this one. You can put them there. Another one, yes, same date. You can have 3 of them there. Okay, the next thing that we need is to do what? The drug, isn't it? Okay, the drug, but before we get the drug, we need to get what? Spirit. So for spirit, I can get the same spirit. December 2027, that's when it's expiring, it's potent for use. We'll pour away from the label. Now at this point, we need to prepare now the drug, isn't it? So the first thing, I get the drug, I open, okay? I open like that. Now, I need to get this one, the chitophosphate, then so, from top to bottom, right? Then I'm supposed to do what? Throw it. Now, when you're throwing, you tell your assistant, isn't it? Please don't forget to swallow the cotton swabs. Away from there. You are not supposed to do this, please. Eh? Okay. Allow me just to separate them like that. So I'll get the drug since we cleaned on top. Then we'll clean this part. So I will Throw it there. Then what do I do? So either you can put it here or in the what? In the receiver. Okay? Okay. Now when you look at this, okay? This is now the what? The sterile water or water for what? For injection. So what do? We only clean this part, okay? So I'll get this one. I clean like that, okay? Then what do? I put it there, I throw, okay? To cut the story short, you are supposed to clean all of them because we are saying these are 2 meals, okay? 2 meals and they are supposed to be what? To be cleaned, okay? So let's clean them. We'll just clean them like that. We'll put there. We clean this one, we'll put there, but using different what? Swabs, okay? Then you throw and take it. We have already prepared everything, isn't it? Okay. The next thing that we need is now to go and what? Scrub. After scrubbing, I come to this, okay? But there's one thing that I need, okay? So the assistant can open now. I need more gauze. So the assistant can open. This is the importance of having, okay? So I'll get some gauze from there. You can put them there. I need some soaps, extra soaps. Okay. I go and scrub. So at this point, what we do is now to start preparing, right? You can prepare whatever has been prepared. How many soaps? Initially, you're not supposed to talk it. How many soaps do we need for? 2? Not 3? Okay. So we have prepared this. Then the next thing is to start now what? We need to get this, okay? So now, like that. So you can put these in the sharp box, eh? The assistant? We can get just the receiver so that we can throw the. We can get the receiver. So you need to be careful with this, eh? Okay, we get this one. Okay, so we have this. Then for this one, so even on this one, when you are withdrawing, you're supposed to use the gauze. Like you can do it here. Put it here, then you can cap this one, the sharp box. If you are scared of contaminating alone, you can leave it there, okay? But you need to recap now. The one that you have used is not supposed to be what? Then this one is going to that receiver, okay? So can I get the receiver? Okay. So the next thing that I will do is to get now this one. We are saying it's how many? What did we calculate? 4.8. Okay, so 4.8. You can go to 4.8 there. Yes. You make sure that all the bubbles are not. Then you can recap it that way. Put it in that receiver, you can go now. So the next thing is to go to the patient, isn't it? So the assistant is going to help us to uncover the patient so that we can do it. We can now inject, okay? So now we are going to position the patient, but now in the meantime, we are using this pattern. So you can just put it on top here. Just put it in on top for the sake of, yeah. Turn it. Yes. So now at this point, I am coming now for the last time to confirm the name, isn't it? Okay. So I'm coming to confirm the name. Then, good afternoon once more, sir.
Good afternoon.
You said your name is?
Mr. James.
Mr. James. Okay, so we are back. We want to give you the injection on the gluteal muscle. We are going to position you so that we can give you on the gluteal muscle. But the drug might be a little bit painful. Then we'll allow you to rest for 5 to 10 minutes after we give you an injection. So at the moment, I want to clean where I'm going to give the injection. Okay? The patient has accepted. So now, from the iliac crest, so the iliac crest to the what? The foot of the buttock. Okay? I throw it then from where? The sacral region to where? Okay. Then, where am I giving? Okay, upper outer, I clean like that just once. So the reason why are we avoiding to give from these other aspects? We remember, we know that the sciatic nerve is starting from which, when you go on the spinal cord, eh? Okay, so it is starting from where? The lumbar region number what? 3, okay? Lumbar region 4, okay? Up to the last one, which is now the sacral region number what? Number 3. Are we together? So all those areas you find that it has some branches, okay? So it has these branches like this. So now all of them, they are coming where? And the other thing that we need to understand about the same sciatic nerve is that it is the largest nerve, okay? So it is coming from that aspect. Then the thickness is about 2 centimeters. So you can say you inject here, that's why it is passing. You inject here, that is where it is passing. So the only way, or the only region it doesn't pass is the upper outer what? Quadrant, okay? So at this point, I will get the what? The dry swab. Okay, I'll get the dry swab. I take it that side. Then what do? I get this, isn't it? Okay, I remove it, pass it this side. Then I go with what? On the swab, okay? Then I go in like that. All the needles should go in because we are going into the muscle. You withdraw, you see that there is no blood. Then you do what? You push in, okay? The injection, it goes in until everything is done. Then you just hold like that, okay? Don't talk to the patient after giving the drug. Eh? The patient is in pain. So you can just leave them just like that first. You remove this one. Sterility is done here. You remove this one. Can I have the sub box? So you remove this one. You take it to the sub box. This one, you throw it there. Then when the patient relaxes, that's when you can give now IAC. If it is during OSCE, when you just inject, give IAC. On a normal patient, give IAC when the patient has stabilized. Tell the patient to rest at least from 5 to 10 minutes. That's when they can even walk. Are we together? So that's how you can give an injection. The next thing that you're going to do is to get now the drug chart and sign against the same time you're supposed to do it. To sign. Since it is 16 hours, you're going to give, if it was at 14 hours, you're going to give your initials. Okay? That's how we can give. The next thing, before you dismantle the throat, go to the ward in charge. With what? The key. Give the report that I have given the drug on this, and the patient is still in recovering position. The patient is still recovering. Then you give them, you hand over the keys and go back to the what? To the throat and do what? Dismantle the throat. Are we together? So that's how we can give the drug to this particular patient. This is IM. Okay. For the deltoid muscle, the patient has to be in a sitting position. Hello? The patient has to be in a sitting position if they can sit, okay? Because we are going to put the what? The backrest. But where are you giving? We are giving on the what? The deltoid muscle. So from the acromion process, 2 fingers like that. Then where the 2 fingers are ending, that's where now you give the what? The injection. And here we don't give more than 3 mils, eh? Yes. It's just others they will tell you to say 1 to 2 or 1 to what? 2 to what? To 3 mils, because the muscles are not big enough compared to those. But when the gluteal muscle give up to 5 mils, above that we don't give. Are we together? That's what we give.